So we often hear about the dangers of sugar when it comes to tooth decay, but can you explain how excess sugar consumption affects our gut health and can lead to other health issues?
During the holidays, especially Halloween, what we end up doing is we overconsume sugar. And like a fun size chocolate bar has about 10 grams of sugar when children should only have, I know, it's crazy. And children shouldn't have more than 21 grams of sugar. So many, and especially really young children. But it's going to affect your gut biome. And sometimes what then ends up happening is when your gut is compromised, it's going to affect maybe the uptake of calcium or other crucial minerals and vitamins as well. Right. So we got to look out for that. And then also is related to periodontal health, your gum disease, because now we're creating more inflammation everywhere.
And with Halloween just around the corner, many children and adults, I can't even keep Halloween candy in my house before Halloween.
Same.
So we all indulge in those sugary treats.
That's a
Um,
rule in our house. No sugar early. You can't bring candy into our house.
last minute for sure. So, what's the connection though between sugar and sleep disturbances, especially in children?
Yeah, so well, our blood, well, and especially with children, which we already see, is their blood sugar levels are going to spike. So we see that fluctuation happening. And think about when we go trick or treating. I wish it was earlier, but it's usually later on. And for some little ones, especially, it's usually after dinner. And now what we've done is we've created this fluctuation in their blood level, with sugar blood level. And then now we're going to disrupt their sleep. And now they're going to go to bed late. And there is actually a finding with increase in night terrors as well, with the increase of sugar intake.
Oh, that's interesting. I wouldn't have thought that. And I actually want to go back to a point you made about 21 grams of sugar. That's per day, I'm assuming.
Yeah.
And does
I mean,
that
what
include things
wild
like, sorry, does that include things like fruit as well that we get naturally occurring sugars?
I know that's the hard part. I mean, there's sugar in even like the organic red pasta sauce. There's literally
Right.
sugar in everything. But yeah, like we're not meant to have that much sugar, especially children. Even like the little juice boxes can have up to 19 grams of sugar. I'm like, well, there goes your sugar intake for the whole day. But that's what is supposed to be 21 grams.
Okay. So, what are some practical tips then and strategies parents can use to help their children enjoy Halloween? Because we don't want to ruin the day for them. But how can we still have it be fun and not cause a lot of damage to their teeth or their health?
Well, I have young children as well, so I can't dare take away Halloween from them. So yeah, I let them, we do trick or treating. We go and they're like, my youngest son is like, I'm gonna kill it this year for Halloween. Like he's so pumped. He wants to get like a bigger bag. And so we get all that. But then when we come home, we will let them indulge in a few for sure. But then we make sure that, they brush their teeth, or what we make sure is depending on what time we go trick or treating, it's usually a little bit earlier because we want to go before it gets dark. Try to have a meal. Have a meal and then have some chocolates around it. The worst thing you can possibly do is snack with the candy all day, right? Or all evening or the next day. So I let my kids have few or a little bit more than few during Halloween, and then make sure that you brush and really floss their teeth well before they go to bed.
And what about like in the days following? Do you dole it out or how do you deal with that? Because some people actually have a candy fairy that comes along and takes it all away after a few days. What's your solution to that?
Right. I mean, or you know what? Sometimes, like, what we'll do is we'll trade in the candies for a toy, right? We just got to be creative, and we can't make it feel like it's like taking your away candy. It's almost like we're creating this negative connotation around it. Just don't make a big fuss of it. Just show them there's other alternatives. Like we make homemade gummy bears, super easy, super simple to make. We make like gummy worms. My kids love them, but if obviously they're going to crave something even sugar, like something that has a lot more sugar in it. But you can make homemade trail mix, homemade, so many great, so many great alternatives. So I feel like we shouldn't really be saying we're taking this away from you. Just approach it in a way that, hey, guess what? We got something even better. Let's get you a toy, right? So we do that a lot with the kids as well.
And one of the things I've seen that I think is really entertaining is I've seen people take the candies and bake with it and share it with, friends and neighbors afterwards. So they'll make, cupcakes with M&Ms in them or things like that. So there is the possibility to be creative for sure.
We're just still distributing candy
Yeah,
even
but to
later
other
on.
people,
You can it. It's not a crime. Just get rid of it because it's creating more havoc than good. So it's okay. I mean, I think
No,
that
I
it's
don't
creative and
think I'm
good.
ready. I don't think I'm ready for it. My kids are already done Halloween. But we still have it in the house for the younger kids for sure. So let's talk about the oral hygiene though, because obviously kids are excited about Halloween. They're not excited about brushing their teeth or flossing or any of those things. But you work with young kids, you have young kids. How do you get them to make this a habit, especially, because it's not just Halloween. We're also heading into the holidays and again, loads of sugar in our future.
Yeah, I mean, that's a tough one, but I think it's really on the parents. I would say a child as old as even 12, we should still be monitoring them how they're brushing their teeth. You watch them brush their teeth, especially like an older child, like a 10-year-old or a 9-year-old, but then you make sure, then you check to make sure the back molars are brushed well, because that's where the most likely to get cavities on the back teeth. I think it's still really important. I know we're busy, but I still think it's really important that we're really involved with our children to see how they're brushing and flossing because look at the long-term effects. Look at the long-term consequences, I should say. Is do you really want to bring your child into the dental office, getting those cavities filled, right? So if we can avoid it, let's just take that extra time now, every night or every other night even, making sure they're flossing and brushing, right? If we do it, maybe do it with them. But toddlers is a whole new ball game. It's more challenging, but we just got to do it because you do not want cavities on little ones. Do
Well,
whatever it
there's
takes.
you,
Prevention is a key, right?
and you hit on something really important. Aside from obviously the health implications, there's a financial implication to all of this as well. So it's
Yeah.
much easier to stay on top of it, instead of having to get cavities filled and things like that. So let's talk about those post Halloween dental checkups. Should parents be booking in for a checkup after Halloween within so much
I think
time?
everybody has like a different checkup schedule because most people are on like a 4 month or 6 month or 9 month recall for their cleanings. But I would say maintain that, don't push it. If you know it's approaching soon, definitely don't push it. And just getting in for the routine healthcare is going to prevent more cavities for sure because we always review what the brushing and hygiene is like, right? It's always a review for the parents, always a review for the children as well. And then we also review other reasons kids are getting cavities. It's not just because of the sugar. It's also going to be because we talked before about mouth breathing and poor gut health, right? So the sugar is not helping the gut.
All right, excellent. You are always sharing great information all over the place. Of course, on your familydentalguelph.com, you have a blog. But where can people keep up with you on social media?
On my Instagram handle at Dr. Mandeep Johal, I have tons of information and videos for parents, children, and adults on everything I provide at my office, all the services. And it's not just about how to brush your teeth and floss. It's about everything, holistic of you from head to toe, and sleep really comes down to that. So it's really important to me.
That's really what I love about this series with you is that we're covering, it's not just about cavities, it's about your overall health. So that's perfect. And I just want to let people know as well that you're going to have a blog post up on what she said talk.com about this very topic. So thank you so much for joining me today.
Thank you for having me.